For healthcare workers, it's particularly important to get vaccinated yourself and also to ensure that all of your patients above the age of 6 months are vaccinated. As Bill Schaffner noted, we're also emphasizing pneumococcal vaccination. There are 2 types of pneumococcal vaccination. We recommend the pneumococcal vaccination for everyone over the age of 65 and for some people under the age of 65 who have chronic health conditions such as diabetes or chronic lung disease. So when you get your flu vaccination, be sure to make sure that you're up to date on other vaccines. We have a call to action with 3 steps. First, get vaccinated. That's the best way to protect yourself, your family, and your community against flu. Second, take everyday preventive actions. Cover your cough and sneeze, and if you're sick, stay home. And third, if your doctor prescribes antiviral medications, take them. They're a second line of defense. The analysis that CDC scientists have done suggests that these medications, particularly if given promptly, can reduce the duration of illness by about a day and can reduce the severity of illness. The bottom line, flu is unpredictable, but you can predict that the single best thing you can do to protect yourself is to get a flu vaccine. Make getting a flu vaccine a norm for yourself and your family this year and every year, just as I do. Thank you very much.
Thank you, Tom. Thank you, Tom. Kathy, Dr. Newsel.
So,
would you like to stand up here?
oh, sure. So thanks, Bill, and thanks, Tom. And I am passionate about influenza, as you heard from Bill. I've studied influenza vaccines for most of my career. I'm also a practicing physician, and unfortunately, I've seen too many patients with influenza. We heard from Dr. Frieden the figures on influenza. I've seen people who have died from influenza. And while most deaths do occur in older persons in the U.S., young, healthy people die from influenza every year. Children die from influenza every year, and we'll hear a little bit more about that from Dr. Swanson. People get sick with flu, and people also just feel bad. If you talk to people with influenza, it's not a cold, it's not a sniffle. They'll say, I feel as though I've been hit by a truck. That's one quote I've heard from a patient. Or I feel like I've been beaten up. So flu also makes us miss work, makes our children miss school, and makes us feel bad in general. So the news is that more people are getting vaccinated, but far too few are getting vaccinated. And as Dr. Frieden said, we need to try to improve that. So where can a lot of the gains be made? And a lot of the gains can be made in the young and middle-aged adult population. So let me tell you another story about a medical story when I was asked to see an older patient who had been in the chronic care portion of our facility, had been there for about 6 months. We were called to see him, and we diagnosed him with a pretty severe influenza pneumonia. Then we started to ask the question, well, he's been in this facility for 6 months, and pneumonia circulates every year between about November and March, and of course it changes. Many years it doesn't circulate till January. How did he get the flu? He's not out there going to the store, and the only way he could have got influenza is because somebody brought it to him. That could have been a healthcare worker. It could have been a family member or a friend visiting him. And so for young and middle-aged healthy adults, protecting others should be as compelling a reason to get the influenza vaccine as protecting yourselves. And if everybody thinks about it, there would be very few people in this room who don't mix every day with young children, with older people with cancer, people with serious lung disease. We are walking around, we are the transmitters in the community. And so it's quite important that we get influenza vaccine for that reason. So I think the public health and the medical and the research communities have been listening So why don't people get influenza vaccine, and what can we do? Well, first, there's we didn't know we needed it, which is one reason that we're here today. You do need it. We strongly recommend influenza vaccine for everyone 6 months and older. The second reason is, I'm kind of invincible, right? I'm young and healthy, I run every day, I eat right. You can still get flu, and importantly, you can certainly transmit that flu to people who aren't as young and healthy as you are and are much more vulnerable to the complications. None of us have time, right? We're all busy, we're all rushing around. I don't have time to get the flu vaccine. So we've really tried to listen there too. And vaccine is now available in the workplace. It's available at pharmacies. It's available earlier than it used to be, and it's available later than it used to be. So we really need to make it a priority. And the number of flu vaccines and choices we have is much greater as well. So if I don't like needles, I can get the nasal spray. I can get the intradermal vaccine, which is a tiny, tiny needle. If I have a patient with a really severe egg allergy, we now have an influenza vaccine that's recombinant, totally egg-free, that I can use in those patients. So we do have many, many more options now, both as individuals and as healthcare workers promoting influenza vaccine. So thank you.
Thank you, Kathy. That's a stirring affirmation. Dr. Swanson, please.
Hi, I'm so glad to be here and share my opinions and ideas. I come about this as a practicing pediatrician, but I also come about this as a mom, as a daughter to people with chronic illness, and I come about it as a blogger. We live in a really different time with how we get information and how we build partnerships with evidence and with science. And the great news is that parents and families who are making decisions about vaccines, they trust their pediatrician and their healthcare provider most. They lean on their spouses and partners when making vaccine decisions, but they're certainly online and connected. So we know without hesitation that the 3 tiers of washing your hands, staying home when you're ill, and of course being vaccinated are essential. But we also know now too that all children over 6 months of age should get a flu shot every year. We know that there's continuing build of immunity over the years, and we know that children who are under age 5 are more likely to be hospitalized than older children. So there's a group that's more vulnerable, and those are the kids that go to preschool, that go to daycare, that go to kindergarten, they swap spit and snot and saliva. These are the kids, right, that are exploring the world with their curiosity and advancing. They're also the ones who can get so sick from influenza. There's no question that in my practice as a pediatrician, I've seen kids not have their parents make the decision to be vaccinated and get influenza. I've seen children who've had febrile seizures during a course of influenza. I've seen children with wheezing and asthma have serious cases of influenza, lose 10 pounds, be out of school for 13 days because they're scared of a needle. Just like we're learning, we've got so many choices now, particularly for kids over age 2 who can choose the nasal spray as a great option. So we have all sorts of choice, we have all sorts of data, and we want families to know this is just a part of being a kid. Like I always say, snot's a part of being a kid in the wintertime. A flu vaccine in the fall is also a part that we want for every family. And we know that parents' intention to immunize really is driven by protection of their own children. But we also know the great and profound benefit that kids who go to schools or live in communities that are better immunized are less likely to get infections that are protected by those immunizations. So we've got this kind of bold and new task to make sure that all families understand this is an every year thing. We know that patients and families have really good trust, particularly when they're vaccinating their children. We know 9 out of 10 families in America follow the guidelines and recommendations for getting vaccines on time. It's few who actually choose to delay or space them out. And when we look at influenza vaccine, we know parents really want to protect their babies and toddlers. In fact, 75% of infants and toddlers were immunized against influenza last year. And just like Dr. Frieden mentioned, we know that children die from influenza every year. Last year, over 140 children. And the harsh reality it isn't only children with underlying risk risks, being very young, having things like asthma or wheezing, having chronic conditions like diabetes or neurologic conditions. We know on average about half of the pediatric deaths happen in healthy, well children who get exposed to a virus and have a bad course of that illness. So as my job as a pediatrician, a mom to 2 little boys, we get immunized early. I want to partner with patients and families to get them information in arm's reach. So I use Twitter, I use Facebook, I use my blog, I partner with the Academy of Pediatrics, and I listen to what people say online and try to get them the science that we have that we know can protect them. The other thing that we should mention is that we do, of course, want all healthcare providers to be immunized. We used to wear buttons that said, I got my flu shot today. Now I recommend that all of our physicians, staff, medical assistants, receptionists go online to Facebook when they get their flu vaccine and tell the world that they've done it. And we know that so many organizations across the United States in healthcare facilities are even asking all workers if they're going to choose to take the privilege of caring for children who are ultimately a vulnerable population, that if they're going to do that and work in a hospital, they have to be immunized against influenza. So we have great protection, and we have just great opportunity to prevent illness, missing work, high fever, discomfort, and pain with a great vaccine. That's it. Yeah.
So let's just say a few words about pneumococcal vaccine. Pneumonia is the major complication of influenza, and the principal bacterial cause of that pneumonia are the pneumococci, that bacteria. As Dr. Frieden said, pneumococcal infections can affect anyone but are particularly deadly in older persons. And as you would expect, those at highest risk are the same people recommended for pneumococcal vaccination. These are somewhat more complex recommendations, so it bears emphasizing briefly who these groups are. Everyone age 65 and older is eligible for pneumococcal vaccine. Adults 19 to 64 with certain chronic illnesses, such as diabetes, heart disease, lung disorders, and smokers. Infants and toddlers are also at highest risk, but they tend to be well vaccinated because pneumococcal vaccine is part of the routine immunization series for children. There are 2 types of pneumococcal vaccine recommended for adults. Conjugate, we call that PCV13, Prevnar, and polysaccharide vaccine, PPSV23, called Pneumovax. The specific recommendations about which vaccine or vaccines to get depends on a person's age and medical conditions or their risk factors. What we want people to know is, if you're in one of those groups that I mentioned, ask your healthcare professional which vaccines you need to protect yourself from pneumococcal disease. These vaccines work. In March of this year, a new study in the New England Journal of Medicine reported on the effectiveness of PCV13, the conjugate vaccine, in those aged 65 years and older. There was a significant reduction in vaccine-type pneumococcal community-acquired pneumonia in those vaccinated with PCV13. The study was large. It included 85,000 adults aged 65 years and older with no prior pneumococcal vaccination history. It's quite a definitive study. Together, these 2 pneumococcal vaccines give adults broader protection against pneumococcal disease than either vaccine alone. Medicare will pay for both types of pneumococcal vaccine in full, no copay or deductible, as long as they are given 1 year apart. You do not get both pneumococcal vaccines at the same time. However, you can and should get flu and pneumococcal vaccines at the same visit if both vaccines are recommended for you. And then you can get the other pneumococcal vaccine next year when you come back for your annual flu vaccine. So this 1 year timing interval works well both scientifically and practically. And finally, if you're an adult who was vaccinated with one type of pneumococcal vaccine, once again, talk to that healthcare provider to see if you need the other type as well. So at this point, thanks again to all of our panelists. It's great to hear that nearly half of the U.S. population is making flu vaccination an annual event. More is better. We're clearly making progress. and we still have a way to go. The National Foundation for Infectious Diseases is again inviting healthcare professionals, business and community leaders to lead by example and make influenza prevention a public health priority. And our friend Dr. Frieden will be the first to lead by example by getting his flu vaccine today, right now. Tom?
All right.
So thank you, Dr. Frieden, and thank you, B.K. Morris, the nurse who was here with the MedStar Visiting Nurses Association. And you know you're all invited. After the news conference, we will have influenza vaccine available for all of you, and MedStar Visiting Nurse Association is happy to provide it. Now, let's have a little question and answer. The Q&A portion of the event is reserved for questions from you all in the media. We have 2 roving microphones. Please indicate if you have a question, and one of our staff will get it to you. And if you would just identify yourself in the media outlet when you make your comments. For the media participating via the webcast, please email your questions as indicated on the webcast. And if you're on the teleconference, the operator will come on the line momentarily to advise you about how to submit your question. And finally, if you would like to speak with one of the panelists one-on-one, we can arrange that after the Q&A session. So thank you very much. I'd like to now open the question and answer session. Is there somebody here who would like to ask a question? Lauren.
Lauren Niergaard with the Associated Press. I have 2 questions. First of all, I'd like to get all of you to address the autism and vaccine statements that were made at last night's presidential debate. What do parents actually need to know about that? And then after that, I do have a flu-specific question, I promise.
So let's deal briefly with the autism issue. I think everyone in this room knows that there is an abundance of scientific evidence indicating that there is no connection between the administration of vaccines and autism. Likewise, the currently recommended schedule for immunizing children, recommended by the CDC, the American Academy of Pediatrics, and the American Academy of Family Physicians, clearly is effective and it is safe. I think we can talk about that a little bit more offline, but let's go to your flu question now.
Could Dr. Frieden address that?
Wendy, Sue, actually, we might take this opportunity. You're here on the behalf of the American Academy of Pediatrics, and they actually have a brief statement on this issue. So
We do, and just to respond, certainly there's lots of chatter about comments that have made, and this comes in waves in some ways because we share sometimes scary anecdotes that may not reflect what science actually brings to the table. You know, the great, wonderful benefit of living in a time of science is that you can aggregate all sorts of anecdotes together and come closer to truth. So I think what we know is that there were comments that were made about the purported link between vaccines and autism. We know that no science has ever proven that link, including, you know, an Institute of Medicine report that studied over 1,000 studies and came out on the side that vaccines are certainly far more beneficial than the risk, and no link was purported. You know, the other really, I think, follow-up point that came in sound bites is really that somehow an alternative or spaced-out schedule is a good idea. What we know about that is that's an untested schedule. We have not a single study that demonstrates spacing out or delaying vaccines provides any benefit. In fact, it's the same amount of risk, the same vaccines, and more risk because the window of time that children and those in their community could be exposed to illness is bigger. So I'd love to read the statement from the American Academy of Pediatrics that was released today in response to the comments from last night that addresses both your question about the purported link between vaccines and autism and alternative schedules. Quote, the American Academy of Pediatrics would like to correct false statements made during the presidential debate last night regarding vaccines. Claims that vaccines are linked to autism or are unsafe when administered according to the recommended schedule have been disproven by a robust body of medical literature. It is dangerous to public health to suggest otherwise. There is no, quote, alternative immunization schedule. Delaying vaccines only leaves a child at risk of disease for a longer period of time. It does not make vaccinating safer. Vaccines work. Plain and simple. Vaccines are one of the safest, most effective, and most important medical innovation of our time. Pediatricians partner with parents to provide what is best for their child, and what is best for children is to be fully vaccinated.
And Bill, just to say further that at the Centers for Disease Control and Prevention, one of our centers is the National Center for Birth Defects, and so much of the nation's data on the trends in autism come from CDC. It's a serious problem and one that we're analyzing and helping to link parents to services. Study after study have concluded that there is no risk between vaccines and autism. There is, though, a very serious problem of autism, and the discussion of vaccines and autism, unfortunately, has at times interfered with our ability to study further what is causing autism so we can both prevent it better and provide better services to the children and families who have autism.
In light of what happened last year, with all of our pandemic preparations, what now could make us more nimble in responding if we have a situation like that again, where you are able to see that a problem is brewing with a mutated strain?
Well, there are three things that we do to try to minimize the risk that if flu changes, we won't be adequately prepared. First, we are better tracking flu in this country and around the world so that when it changes, we identify that in as close to real time as possible. Unfortunately, last year it changed when the flu vaccine was already being made. So at that point, there was nothing really that could have been done practically. The second thing we're doing, along with manufacturers and other entities, is cutting down the time it takes to make a flu vaccine so that we can start making it later in the season and still have, as we do this year, more than 171 million doses, enough for everyone who wants to get a flu vaccination. The third thing that we do is have a second line of defense, understanding that even in a well-matched year, flu vaccine, although the best way to protect you is only 60% or 50 to 60% effective, is particularly for those with underlying conditions or are severely ill with something that may be flu, to encourage treatment with antivirals, which may keep you out of the hospital, reduce your duration of illness, and reduce your severity of illness as well.
Thanks, Tom. Questions? Wendy Sue, we didn't talk really about the importance of protecting pregnant women. Would you like to say a few words about that?
Yeah, I would. So, I think one of the things every expecting parent does is get really excited about a long life for their child. And, we know without question that pregnant women are at higher risk for complications from influenza because of their immunocompromised state during pregnancy. We also know when moms immunize themselves, they do two things. They protect themselves, and they also provide protection for their baby after their baby is born. So we know that in addition to providing the cocooning, so if mom is immunized against influenza, if dad is immunized against influenza, after the baby's born, much less likely to bring it home. But secondarily, when moms get immunized during pregnancy, any time during pregnancy, they start to develop antibodies that go through the placenta and transfer to the baby, so that in the first 6 months of life, when babies are high risk, but also too young to be immunized, they're better protected.
Excellent. Actually, we have partners here from the American College of Obstetricians and Gynecologists. Dr. Riley, why don't you stand up for a moment, let the people see you, and I know you would like to reinforce those messages. Go ahead.
Absolutely. Thank you for the opportunity. I'd love to reinforce that we really encourage all pregnant women to be vaccinated at any trimester, first trimester, second trimester, third trimester. Get the vaccine. You'll protect your baby as it's growing inside, and importantly, you'll protect your newborn in the first 6 months of life before that baby can get its own vaccination. And the other thing I think is really important, as many have said, is that there's tons of data to suggest that this is a safe vaccine, and I think all pregnant women, particularly pregnant women and their families, are always worried about the safety of anything, any medication, any vaccine, but we have great data to suggest that this is a safe vaccine, and certainly it is offering great protection. Thank you.
Thank you. Thank you, Dr. Riley. We have some questions on the phone.
Yes, sir. The first of which is from the line of Liz Fabel with USA Today. Please go ahead.
My
Hi,
question's
Liz.
been answered. Thank you. Hi, my question's been answered. Thanks.
Okay, thank you very much. And then I have some questions here. Let's see. So perhaps we could have some information about how many vaccines have been shipped already, and we anticipate that we will have an abundance of vaccine, and vaccine is coming in. Tom, do you have some comments about that?
So simply that there are, we believe, more than 171 million doses of vaccine being produced this year. More than 40 million have already been distributed. As is usually the case, you may have situations where in some areas some of the vaccines may not be available for some of the time, but in general there will be enough vaccine for everyone who wants it. And as there were last year, and as was mentioned earlier, there are lots of options for different vaccination types. Intradermal, a tiny needle. I will say the needle I just got wasn't intradermal, but I still couldn't feel it. There's also the intranasal vaccine, and we don't have a preference for any of the vaccines from CDC this year.
Excellent. So I have another question here. This is from Anna Almandiva from the Huffington Post. So we're offering vaccines currently, Kathy, but she wants to know, is it too late to get vaccinated at any time during the influenza season?
Yeah, that's an excellent question and a very common question. We heard from Dr. Frieden the total amount of vaccine available, but we know the availability at the local level can sometimes be quite different. So the short answer is no, it's not too late to get influenza vaccine. In fact, if you sort of tease out some of those data that Dr. Frieden presented, it's interesting. For pediatricians and other providers of vaccine to children continue to give vaccine through the whole year. But adults tend to get vaccine by November or not get vaccine. So our message here is the soonest you can get it, the better. But it's never too late to get influenza vaccine. There are years when influenza may not circulate till February. There are years where we may have a lot of flu in December, and then it comes back again in March. So give vaccine, give it through the season, continue to give influenza vaccine, and in fact, it's not too late to give influenza vaccine in October, November, December, January.
Excellent. So we have a note here from Sonia Collins from Pharmacy Today. She's directed the question to Dr. Frieden. What guidance do we have to the public regarding the various members of what we call the immunization neighborhood? Where can we go to get vaccinated against flu, pneumococcal disease, and indeed other vaccines, Tom?
Now, in every state in the U.S., pharmacists can vaccinate against influenza, and in many states against other diseases as well. The key about vaccination is making it easy for people, reducing the barriers to vaccination. And that means that if you're at your doctor's office, at your nurse practitioner's office, if the doctor or nurse provides a vaccine, or your pharmacist, these are all great options to get vaccinated. What we're seeing is very interesting. We're seeing increasingly convenient vaccination options for Americans. Many Americans are now getting vaccinated in their workplaces by doctors or nurses or pharmacists. In fact, this is really important, and one of the reasons this is happening is that businesses recognize that vaccinating their employees is really good business. It means fewer sick days, more productivity, lower healthcare costs. Flu vaccination is a best buy for healthcare providers and for businesses. We're also seeing more minute clinics or small clinics in pharmacies.
For example, just in that year period, there's protection. And then a second question, and this can be for all of the doctors, whoever would like to answer, what do you say to people who are reluctant to get the vaccine? Because there's this thought process among some people who say, if I get the vaccine, I'm going to get sick, I'll get the flu.
No. If you get vaccine, you won't get the flu. At least the vaccine is 50 to 60% effective. That's a myth. I think we can all sing this in harmony. You can't get flu from the flu vaccine. Thank you very much. And it's important to keep reminding people about that because, quite realistically, it's one of the most common questions that we do get asked. So Miriam Falco here.
Do you want to answer that first question?
Oh, sure.
Well,
Go ahead, Wendy.
And I think
Dr. Swanson, please.
Yeah, I'd love
That's right.
for backup from both of the other docs here too. But, part of the reason we recommend, for example, the rules around kids 6 months of age to age 8, if you haven't had 2 doses before, you get 2 doses because you build immunity that way. We know even with drifted strains, there's still some partial protection. So even when there's not a well-matched vaccine, we know we get partial protection, are more likely to have more mild illness than more severe illness. So there is benefit to the kind of essential part of an annual vaccine that over the years you're building up immunity in a community to influenza.
All right, guys, we're going to leave this because we're going live now to downtown where Sheriff Joe is speaking.